Hello. Welcome, welcome, welcome. If I start, I will be repeating myself. Moteleola, thank you so much. You are still there. Dennis, I can see you. I want us to just be patient a bit so that we can do justice to the topic. It's a very nice topic. Mm. Thank you for coming. I'll be talking about placenta previa. It's an emergency. Oh. If a woman presents with placenta previa, because most of them they do bleed seriously. They do bleed seriously that, you know, hey, abeg oh, sorry oh. I'm doing my life. I don't know how I joined you. Please, can you just off it from your side? Thank you. Oh my God. It's so funny. Welcome, welcome, welcome. I am still waiting. I am waiting for people to come. So we can go straight to the topic. Placenta previa is a very interesting topic. Mommy Zeze, thank you for coming. I think I'll just wait for one or two people, then I will start. Yes, so that I won't take your time. And before my time goes, I have to do something about it. I'll be talking about placenta previa because I am a midwife. I am a registered midwife. My license is up to date. Though I'm retired, but I'm not tired. I love midwifery. I love midwifery so much that when I see any pregnant woman, it gladdens my heart. I just came back from the UK for a vacation, and the place I stayed, Derby, we used to go on a stroll in the evening to one park. So one day like that, I went there and I saw this white lady with a newborn baby. Oh my God. I introduced myself to her. I said, I love newborn babies, that I'm a midwife. I was telling her that, why did you bring this? When did you deliver? She said 2 days ago. I said, 2 days ago, and you brought your child to the park, and it was freezing cold that time. It wasn't really summer proper. I said, this baby could catch pneumonia. She said, yes, it just the husband said, I told her, but she refused to listen to me. I said, wow, that in my country, if you just giving birth, you have to stay at home for some months or 6 weeks for that baby to be very strong before you can be taking the baby out. You won't believe what happened. Like, it wasn't even up to a week. She lost that baby to pneumonia. When I heard it, I was so sad. I was so sad because I warned her. I told her that you don't carry newborn baby, no shawl, no covering. Even the husband had to run back home to go and bring cap for the baby, skull cap. Ah, what are you doing outside? 2 days old baby. So sometimes, as a midwife, when you see all these things, it saddens me. And that's why I take it upon myself that my life will not just be for any talk or comedy or whatever. I want to help pregnant women. I want to help husband of pregnant women to learn so many things that will be useful to them, that will keep them safe, that will keep unborn babies safe and healthy. And when they have the baby, they will be happy. Because you can imagine for a woman to carry pregnancy for 9 good months, the stress, the wahala, everything, for you to come and lose that baby because of just small mistake. So that's why I'm your midwife. I'm your fashionable midwife, and I'm glad to be here. And I appreciate every one of you online that you are watching me. I really appreciate you. I blow you kisses. Mwah. I love you guys so much. So I think I can start now because time is going. So if more people join, I can always go over it again. Just like I said on my flyer, this night I'll be discussing about placenta previa. Placenta previa. Have you had anything like that before? Or have you seen somebody that went through this case before? It's an emergency case because it's a case of when placenta is not well situated. Normally if you did biology or anatomy and physiology, you know that when the baby is in the uterus, the placenta is always up and is attached to the wall of the uterus, so that the baby can get whatever the mommy feeds on will be transferred to the baby through the cord or through the placenta to the cord, so that the baby also can get even the oxygen. Everything the mother does will always go through the placenta to get to the baby. So as a mom, it's very important for you to eat healthy diet, to eat balanced diet, so that the baby in the uterus can also get whatever good things you are getting, good nutrients, the baby will also get it. So this night, I want every woman to know that placenta previa is a condition in pregnancy where the placenta is implanted in the lower segment of the uterus. It may be partly, it may be complete, covering the cervix. The birth canal is what we call cervix. Your cervix, when you are not dilating, is just like this my nose ribs. It's just like this my nose ribs. So when the baby is ready to come out, the cervix will be dilating little by little, and it will get to 10 centimeter before the baby can be delivered. But in this case now, the placenta is supposed to be either at the upper part of the uterus or on the side of the uterus, not at the lower segment covering the cervical holes. So because it's covering that cervical holes, it will make the woman to be bleeding, and that bleeding is dangerous for the baby. The baby could die, the baby could be delivered prematurely. So many complications that can happen if the woman is going through placenta previa. Thank you for coming. I can see Bless D, I can see Carrie's baby, I can see STA Luxury World. Thank you so much. God bless you. So what are the types of placenta previa that we have? We have about three. The first one is complete, that covers the cervix. It will be at the lower part of the cervix and it will cover the whole cervix, and the patient will be bleeding. Partial, that is the placenta partially covers the cervix. This one is not, the first one I said complete, that's total covering of the cervix, but this partial, it will not cover all. Then the third one is marginal, it reaches the edges of the cervix but will not cover it. It will just be, it's just as if you cover something like this, then part of the cervical holes will still be on that side, but part of it will be on it, and it will also cause bleeding. Then we have another one for the last one, low lying. Placenta is implanted in the lower segment of the uterus but not touching the cervix. This one may not cause any bleeding. The placenta is maybe in the lower aspect of the cervix, but it's not covering the cervix. And this usually happens between 20 weeks of pregnancy, but can also be seen in the third trimester. When I say second trimester, women will understand this. First trimester is about is from 3 months. That's how we calculate it in the hospital. The 12 weeks is first trimester up to 18 weeks. From 18 weeks upward, second trimester, then the third trimester also follow suit. So what are the symptoms of this placenta previa? There will be painless vaginal bleeding. Unlike that day that I talked about abortion. Abortion can bring abdominal cramps. The patient will be having contraction, mild contraction, and she will be bleeding. But in this case of placenta previa, the client will have painless vaginal. She will just notice that she's seeing blood, especially in the second or third trimester, and it's often bright red. The bleeding in this placenta previa is very bright because it's directly from the placenta. Then bleeding may be spontaneous, especially after CS or VE. So most of the time, if they bring this case to the hospital, we don't just rush as a midwife to go and do VE, because if you do vaginal examination, it could aggravate that condition and the patient will now be bleeding seriously, and it's very risky. And it could also happen after sex. Yes, because the placenta is at the lower part of the cervix, and when you are having intercourse, definitely the husband penis will be touching the cervix, and this will also make the bleeding to be much. Then the uterus is usually very soft and tender. In this case of placenta previa, you will see that the uterus will be very tender. The uterus will be very soft. Bless thee. Thank you, thank you, thank you, thank you. All the people that just joined, thank you. I appreciate you. Then, just like I said, the uterus is usually soft and non-tender. It's soft, but it's not tender to touch. There's a case also in the hospital we call the rupture uterus. I've seen so many cases. In the north, we have a lot of cases because some of them they live in the village. So by the time they will come, things most time would have gone wrong. So you will see that the uterus is very rigid and strong. But in this case, the uterus will be soft and non-tender. So how do we diagnose this placenta previa? It's usually confirmed via scan or gentle transvaginal scan and abdominal scan. So when they do the scanning, they will see the placenta where it's being situated, and the doctor will know that this is placenta previa, and he will be able to diagnose the right one that the woman is going through. So what are the risk factors for a woman to develop this placenta previa? Excuse me, somebody is calling me. I don't want to answer. So previous years, if the woman has had cesarean section done before, she could you know develop this placenta previa because of the scarring maybe in the uterine wall. Then previous placenta previa, if the person had it before in her previous delivery, she can also have it again. Please, I will call you back. I'm on a social. I'm doing something. I will call you back. Màá pè ẹ́ padà. Sorry for that. Sorry for that, Jare. Somebody just calling me. So, just like I said, previous placenta previa, then multiple pregnancy also can cause it. Either twins, either triplets, because of the pressure of the babies, can cause the placenta to shift to that side. Then we have advanced maternal age. Most times when they tell that there are ages that is very good, that you are still in your childbearing age, that you are supposed to marry. Most time as a lady, 25, 26, even some 23. Like me, I got married when I was 23. But it's not like that for everybody. But it's always good to marry in time, because as you advance in age, so many things that can happen to you due to your advanced age. So advanced maternal age. Then smoking and drug use. There are some pregnant women that they smoke, they drink, they do all these things. It can also cause it. Then uterine scarring, especially from surgery. Maybe the woman has had surgery, maybe she had a mammectomy, removal of fibroids, or maybe the previous CS her uterus was scared during the the surgery. She could develop this placenta previa. So what is the management? How do we manage this placenta previa? How do we manage it? If it's a mild case, I categorize it into about four. So if it's a mild case and there's no bleeding, we monitor the mother and the baby closely, and we avoid VE or sex. We tell her if she comes to the hospital, we won't do VE, we only do scan for her to see the kind of placenta previa, the types of placenta previa that she has. Then we warn her that you should not have sex with your husband for now because of your condition. So that, because if that's why I always say it in my videos, that as a pregnant woman, if you are feeling something and you come to the hospital in time, attention will be given to you, you'll be treated, and that baby, that pregnancy can grow, and you will deliver a thriving baby. So don't joke with any bleeding during pregnancy. Either is the first trimester or third trimester, any bleeding, please go and see your midwife or your doctor for prompt intervention. Is very important. So we see also bleeding cases. This one, now maybe she's bleeding seriously. I'm talking about the management now. She's bleeding seriously. So you will see that This one will be admitted in the hospital, should be placed on blood rest, should be transfused if need be. She'll be transfused if need be, because she must have lost a lot of blood, and she needs to be the blood need to be replaced for her to be in good condition and the baby in the uterus. Then what we can do again in the hospital is delivery. If most time when this, maybe she has been treated for placenta previa and the thing subsided, she will be on a planned she will be on a planned emergency CS. They will say this one, oh, anytime she comes for labor, we are going to section her to save the mother and the baby, and it's usually at 36 to 37 weeks, if or early if bleeding is severe. Because in most cases, if they should go into labor, because the placenta is in front, before that baby will come out, before the cervix is fully dilated, she can bleed to death, and we don't want that. We want to save her. If we save her, she will be fine. If the baby is already there, she will be able to get pregnant again. But we don't pray to lose both of them. Yes, we don't even pray to lose any of them. But sometimes circumstances can make things to be very hard, especially if the client did not come to the hospital in time. And the good news about this placenta previa is that, with proper monitoring and early care, both mother and child can thrive. Every time I say all these things, what even there's no time I do video that I don't talk about it, that even if it's malaria and you go to hospital in time, honestly, you will be fine. It will not degenerate to a serious condition. Okay, look at a case of a cancer of the breast. I know of a woman that died recently. When she saw that lump, she went to the hospital and they told her that if the best thing is for her to allow them to cut one of the breast to do mastectomy for her, to remove one of the breast. She refused. She said, no. By the time she came back, the thing has metastasized into her lungs, and she was going to Lutz to get treated, to see doctors every time. Eventually the thing metastasized to her brain, and she died at 62 years old. Any cancer, any thing that you are going through, if you go to the hospital in time to go and see doctor, honestly, early intervention is very important. Even to us medical personnel, it's very important for us, because it will allow us to help you to go through so many lab investigations. Your doctor will write it for you, you go and do it. If there's anything there, you will be treated. It's no big deal. It's before that somebody will be, before, if you have cancer or anything, people will be pretending they don't want people to know. They feel that it's a shameful thing. There's nothing shameful in maybe you are sick or you have a kind of diagnosis. The person that will make jest of you, does she know what will befall her tomorrow? So we should take care of ourselves very well. You should go and see doctor as soon as possible, so that you will get treated in time. And as a midwife, I am here to encourage all women to report any bleeding during pregnancy. Never ignore the signs. If I tell you the stories of bad stories that led to death, that was not even supposed to lead to death, you will be shocked. Yes, people will say that if it's our time, like where I was working before in the north, they believe that if it's your time to die, even if you come to hospital in time, you will still die. Let me go to the hospital, because nobody prays to die early. We all pray for long life. That's why we do the needful. We go, we do exercise. If you are big like me, we diet, we watch whatever we are eating, so that we will live a healthy life, so that we will live long. But if God says it's time, yes, we know that there's nothing you can do. But you can't say because you kuku die one day, you now leave yourself. Who does that? You have to do the right thing. It's just as if you want to commit suicide. Why will you commit suicide? Why will you kill yourself? Because you say that at least one day we will all die. So the dangers of not coming to hospital in time in this kind of case is that the patient can lose her life through bleeding. She will bleed, and if you see I've seen this placenta previa. I've seen worse cases of it when I was working in the maternity. You will be running head first, tears straight. Because number one, we can't do VE. If you do any VE like this, it will be as if you open a tap. The patient will be blood will be gushing out. So to prevent her running into shock, because when a patient is bleeding seriously, even no matter what you are doing, the patient can collapse, the patient can go into hypovolemic shock, and it will now be another problem. That's why we always say go to the hospital as soon as you are feeling anything that is not normal. Don't even allow it to degenerate to that stage. You are spotting as a pregnant woman, please tell your husband, I think I need to see my doctor, I need to speak to my midwife, this blood is giving me concern. Because that tiny thing that you are seeing may degenerate to a very serious complication that the patient could lose her life and that of her baby, and we don't want that. As a midwife, I want to see your baby, I want to see you come for postnatal clinic after delivery looking good with your baby. Let me gist una. You know, as a midwife, when I had my daughter in the in early 90s, when I started labour, you know, most people used to say that we nurses and midwife, we are lazy when it comes to labour place. Me, I shouted oh, and that place I was living, they said that we should not shout, it's not good if you start to shout from your first born. That's why you will shout throughout your pregnancy and throughout your delivery period. I say okay, the thing dey pain me na, why I no go shout? I shouted my shout. In fact, they wanted to, because I had prolonged labour, they wanted to book me for CS, but eventually it wasn't done. I deliver normally. So after naming ceremony, we now came for immunization for the newborn and piercing of her ears. My matron then, matron Jegede, she said, Sister Eunice, this one that you are smiling like this, the pain don go. I said, my mom came with me. I said, that's the pain my mom was holding. You know, I've forgotten the pain. And now that I'm seeing my baby, I'm so happy. In fact, immediately I delivered, they just cut the placenta. I said they should put her on my chest. And we started bonding. For you to know that God is great. As soon as that baby comes out, you forget that problem that you might have gone through, the labor pains, whatever it is. So a pregnant woman is like egg. When àwọn Yorùbá sọ pé olóyún a máa ń kẹ́ wọn bí ẹyin ni, because any small mistake like this, anything can go wrong. Because if you look at the maternal death rate, it's very high, especially in this part of our world, Africa. A lot of women are dying through pregnancy, labor complications, because we don't take things serious. And some people, because of where they live, the environment they live, before they will get vehicle to come to town to come and see doctor, things might have gone bad. Thank you, Style and Success. Thank you for joining. JME, thank you. God bless you. Please, if you have any questions, you can drop it in the comment section and I will do justice to it. Now, I want to talk about something very terrible about this case. Placenta praevia. Abi abruptio placenta, they are all under the same heading. There's this complication, we call it disseminated intravascular coagulation. Disseminated intravascular coagulation, DIC, is one of the serious complications that could lead to the death of the pregnant woman if she has this placenta praevia. And what does this DIC mean? In severe cases of placenta praevia, especially in heavy bleeding, the body can become overwhelmed and start forming tiny clots throughout the bloodstream. You know, our body also reacts. That's why you see in the olden days, our parents, in Yoruba, they call it abiku. They will say, that our child, oh, she delivered that baby up to 3 times. Rhesus factor ni o. Because if you are a rhesus positive mom, rhesus negative mom, and you are carrying a rhesus positive mom child, you know, your blood will react to each other, and that person will be having habitual abortion or premature death. Every time she'll be having premature delivery of her baby or stillbirth. Every time stillbirth, because there is a interaction between negative and positive. Then Yoruba, not even in Yoruba land, in the olden days, they will say it's abiku, that anytime she deliver, the baby will die. It's not ordinary o. She'll be going from pastor to pastor. She'll be going from afar to afar. She'll be going from one malam to malam. No. But thank God now that things have really changed. When you are a rhesus negative mom, and when you start attending antenatal, you tell them, or they when during blood investigation they discover that, they will tell you that when you are 20 weeks old, come back to the hospital for organ injection. It's always given during the 20th weeks of pregnancy, so that your baby's blood will not react against your own, and you have uh, a normal baby. So this DIC is a complication that can kill. You can imagine all your blood, the person's blood, forming clots in their body, because the body has used up the platelet that can make the clotting factor, and the platelet has been used up. So this lead to uncontrolled bleeding. The patient will be bleeding seriously, that they have to take her to the theater to either do CS or make sure she's well stabilized before the next action will be taken. Pregnancy is not something to just take anyhow like that, or bleeding, any bleeding during pregnancy. You don't have to wait at home. Please go to the hospital to go and see your doctor. Your doctor, your midwife, they are very important in your life. In fact, abroad, midwife, you see midwife throughout your pregnancy, except if there are serious issues before she will refer you to doctor. It's the midwife that will do everything, take care of you from A to Z. So you see this DIC is a problem, because okay, when the blood there is clot throughout the bloodstream, the clot could travel to the client's brain, could travel to anywhere, and could go into her lungs and cause emotional what do they call it, something embolism, I can't remember now. So you have to be very careful, please, as a pregnant woman, or your wife is pregnant, or you have a sister that is pregnant. Please always encourage them that if they see anything that is not normal, they should always go to the hospital to complain, so that they will be attended to promptly. Whatever may be coming will be taken care of. It's not something that you can just stay at home. And when I was talking about the symptoms of this placenta previa, I said that painless vaginal bleeding in the second or third trimester. Okay, some people, when they are, in abortion, that's where you will know the difference. In abortion, the patient will be having severe abdominal cramps, and she may be bleeding either lightly or whatever it is. Okay, somebody is not having pain, she will not take it serious. She will not know that a lot of things are going on in her. She will not know. She will feel that maybe let me just put part. And we also used to tell this part that I mentioned and make me to remember. If you've had lecture on placenta previa and you are bleeding, all the parts that you have been using, you have to be checking it. Is it coming in clots? Is this just a ordinary watery blood? And the pad have to be kept somewhere, maybe inside the nylon bag, so that when you are going to the hospital, you can show your midwife. This will enable them to calculate how much blood you have lost. Most cases, the clients will just have to be transfused. If not, there will be problem. So please, if you know any pregnant woman, or you are pregnant and she's bleeding, please take her to the hospital. Say, or you are living in an area in the midnight, sometimes, yes, things are really bad, people are scared to even help people. Maybe you are living in a street or in an estate, and maybe the woman and her husband, they don't even have a car, and they come to wake you up that, please oga, help us to the hospital. Please assist them. A lot of women also have died in that way. They want to come to the hospital, then there is no transportation. Thank God for Uber now. That time when I was working 1990, wetin be Uber? We sef that time we no get motor, na leg we dey take waka go our working place. So if they ask you for help, and this our country is not like abroad. If you call ambulance, within a twinkle of an eye, the ambulance is there, the paramedics people are there. They will start resuscitating, start taking care of that client before she gets to the hospital. So many deaths that are preventable in this our country, but because of our health system, a lot of women have lost their life. But you can do your own, and God will bless you. You see any pregnant woman in your area, woman in your area that need assistance, maybe she's going to antenatal, you see her on the road the way she's walking, you can assist her. Please, it's very important. Let us assist each other is very important. And just like I said, as I was talking about the symptoms, and I also said bleeding may be spontaneous and it could be after sex or VE. I also said that that's why when they bring this kind of Timmy, thank you for coming. God bless you. Mercy James, thank you for joining. So you see that this bleeding may be spontaneous. When I say spontaneous, it can occur suddenly and it may be after sex. Maybe she just had sex with her husband and she just see blood on the bed. Please take her to the hospital. Don't even waste time. Or most time when they come to the hospital, even you as a midwife, you don't do VE. There's sometimes they say do gentle VE. You see that gentle VE, hey, can can open it as if it's a tap. And when a client is bleeding, even you as a midwife, you will be agitated, you will be scared that because you don't want to lose your clients. I've seen a case of this placenta previa. The patient died because by the time they brought her to the hospital, as the vehicle they were bringing her to the hospital, because the road was terrible, you know, the thing gbaga, those gbaga gbaga, the placenta was out while the baby was still inside. In Yoruba land is a terrible, dem say ibi ọmọ ló kọ́kọ́ jáde ẹ gbà wá o, àrírú eléyìí rí o, you know my people na, who shout and shout. By the time they came, the placenta was already out and the baby was inside. Definitely the baby was dead. We had to induce her blood transfusion. She had like 6 pints of blood. Placenta previa is an emergency case that you don't have to joke with. In fact, in advanced country, when a woman present like that, sometimes they will place her on complete bed rest in the hospital to be monitoring the growth of the baby, to be monitoring her too as she's responding to treatment. And most time you see that everything will be fine. So placenta previa is an emergency. And I also said that it's usually confirmed through scan, either transvaginal scan or abdominal scan. And even that transvaginal scan, it has to be gently. Tó bá kan cervix yẹn pẹ́rẹ́, if you just touch that cervix like that, it's like you know, something that is already cooking, you now trigger it again. You just hear boo, boo, boo. Some of them, the blood will be coming in big, big clots. In fact, I've seen a case also that 1 pint on this hand, 1 pint on the hand. When one blood finish, they will put normal saline because she has to be on that. If not, a lot of complication can occur. Sometimes, if the pregnancy is well advanced, it's emergency CS. I also talked about risk factors that can lead to this placenta previa, because some of you were not here when I was saying it, and I think it's best for me to also repeat it. I said risk factor: previous CS, the woman has had CS done before, previous placenta previous, a woman that has had this placenta previa can also have it again. Advanced maternal age, smoking or drug use, uterine scarring, especially during from a previous surgery, and complications. Preterm baby, the baby can be delivered before time. Yes, can be delivered because as she's bleeding and bleeding, the baby may die and the cervix may open and she can deliver, she can expel the baby. It can lead to severe bleeding. I've said this. Then placenta accreta. You see this placenta accreta, Ọlọ́run má jẹ́ ká rí. Mo ti rí rí tó jẹ́ pé obìnrin yẹn ó kú ni. Placenta accreta. You know, a placenta that, you know, it invades the uterine wall. It will, ó máa gum ni. So even as a midwife, when you deliver baby during the third stage of labor, you know how we were taught that if we wait to like 10 minutes and the placenta is not out, we can do manual removal of placenta with our glove, and we go into the vagina and into the uterus. We try to scrape it and deliver the placenta gently. But this placenta accreta, I pray that it won't be our portion. It's already attached to the uterine wall. So even if you are trying to scrape it, it won't go. I've seen this case that the patient bled to death. They took her to the theater. They scrape it. You know, uterus is highly vascularized. This woman bled and bled as they are giving her blood. In fact, as they are giving her blood, you will think something is packing the blood. The uterus will be bulky again with uterus. I think eventually, whether I think she survived, but they eventually did the hysterectomy for her. They remove her uterus, remove her fallopian tubes, so that her life will be saved, because the bleeding could not be controlled. See, in fact, working in the maternity, I've seen so many cases that when I see girls just getting pregnant anyhow, I say, hey, hey, hmm. I'm not here to scare anybody, oh, but I just want you to know that pregnancy is not something that you joke with. Pregnancy or bleeding in pregnancy, no matter how no matter how little it is, please go to the hospital. Go and get yourself checked. Go and get your chest examined, and you will regard you did. Young Akpala, thank you for joining my life. God bless you. Mercy James, you are still here. Thank you. Style at Success, thank you. Please, JME, thank you. Please, if you have any question, you can ask me. Ada Stainless, Litsin Yaya Buba. Yaya Buba, kedan garinmu ne na Arewa. Ya kake lafiya lau ko? So these are the points here. I want you, if you have questions, even when I'm off the live, you can always drop the question and I will do justice to it. So I'll be waiting for your questions. I think I've done justice to it. I talked about management. I said the mild cases where there is no bleeding, the client and the baby will be monitored closely. Avoid VE and sex. We will tell them to avoid VE, to avoid sex. And when they come to us in the hospital, we will not do vaginal examination. We rather do scan to know the type of placenta previa that she has. Then, if it's bleeding cases, we do hospital admission, bed rest, complete bed rest, blood transfusion if need be, and delivery can be planned, cesarean section most cases, and it's usually at 36 to 37 weeks if early and if the bleeding is severe. And I also said that the good news about placenta previa is with proper monitoring and early care, both mother and child can thrive. And me, as the fashionable midwife, I encourage all women to report any bleeding during pregnancy. Never ignore the signs. The fashionable midwife cares so much about pregnant women, about our clients, that you are free to ask me question. You are free to come to my DM. You are free to send messages to me or ask me question, and I will also be ready to answer you, because you are precious, and we pray that you will deliver safely like the Hebrew women in Jesus' name. On the day of delivery, you will not lose your life, oh, and you will not lose that life of your baby. But do the right thing at the right time. You are pregnant, either first trimester, either second trimester, either the third trimester, please make sure you see your midwife. You feel things that is not normal, you are seeing blood, no matter how tiny it is, please go and see your midwife and your doctor. Whatever needs to be done will be done quickly, and your life may be saved. I've always said it and I'll continue to say it. Prompt intervention is very important and can save life. Don't joke with your life. Don't joke with your baby's life. So many things that people think that this one will die, but because she get to the hospital in time, her life was saved. So please, as husband, as mom in-laws, as you, the client that you are, because you are the one that understand your body. Nobody, the bleeding may not stain your clothes, but you go to ease yourself and you see spot of blood, you see clots, and you are pregnant. Oh, please call your midwife. Go to the hospital. Nobody will say your wahala is too much, because any mistake, any drawing of it, things can go terribly bad, and we don't want that. We want you to deliver safely. We want to see your bouncing baby. We want to be happy that when you come for postnatal clinic, your baby is bouncing very well, and that smile, that bond, as a midwife, I'm seeing it with you are having with your baby, honestly, it will gladden my heart, and I'll be very happy that all the things that I taught you during antenatal clinic, you use them very well, and here we are with your beautiful baby. I've had a case when I was working in Kebbi State. Do you know that I used to donate my blood? I used to donate my blood for patients. I never knew them from anywhere. But because of the love I have for my profession, to save life of the mother and the baby, there was a woman that was brought for, no, she came for labor or for childbirth, but she wanted to climb the couch and I just saw blood. Pwah! And the husband was not around. Hey! Immediately I sent for doctor, emergency CS. Nobody. It was a neighbor that brought her. The next thing, I just ran to the lab that they should come and check her blood. And me, I'm group O. I'm a universal donor. I donated, and the baby was named after me. This story that I'm talking now, that girl is in secondary school now. She's my darling baby, my goddaughter. I think they're in Port Harcourt now. I've not seen her for. In fact, she did the little bride on my daughter's wedding. Her name is Testimony Eunice, because my name is Eunice. So you see that kind of case, people will say, ah, do you know her? Yeah, you just, I said, let me donate. I will not die. I was feeding well and I'm still feeding well. I donated. Even not only her, not one, two, or three. The people that I worked with, if they are watching this live or they will see it later, they will know that I'm saying the truth. I donate my blood as a midwife to even Fulani that I don't have anything to do with her. I never knew her from anywhere. But because of the compassion I had for her and because I love my job, just to save her, I donated my blood. And I'm here today. God is faithful. I've, in fact, I used to tell people that I have divine health because I cannot say when last I've ever slept in the hospital or I had to go to hospital, except this vacation that I went that I'm having arthritis, and I know it's age, but I know it will go. And me, I'm not even the one that's supposed to have arthritis because my name na shakara.com. If and honestly, even today when I went out, the leg, as I'm touching it, like this, still paining me. Aside that, no, I love donating. Yes, I'm no more working. I'm retired, but I'm not tired. I love midwifery so much. Had it been I'm still young, I would have gone ahead to specialize in midwifery, to see women. I love seeing pregnant women. I love seeing new babies. I love it. So please, as a pregnant woman, take care of yourself. You are bleeding. It's not something to joke about. So I have 4 minutes more before I finish this my live streaming. If you have any questions, even if it's after this live streaming, please, you are free to ask me questions. You can drop your questions on the, okay, there are questions. Let me check. Okay, okay, no question. Okay, exclusive. Thank you. Hope you have learned. Please help me to share. Help me to share this live so that other women can learn, can gain from this topic, placenta previa. Placenta previa. Please let me to share before we go. I have 3 minutes more to go. Just finished talking about placenta previa that normally occur during second trimester or third trimester, where the placenta is situated on the lower segment of the uterus. And I told you that it has like 3 to 4 types. The one that is partial, that the whole cervix is not covered. The one that is total, that the placenta will cover the cervix and the client will be bleeding. It's a very dangerous condition. It's an emergency case in the hospital. Most cases, we rush them to the theater and do cesarean section to bring out the baby so that both the mother and baby will be fine and everything will be okay. So, placenta previa is what we discussed today. Just 2 minutes more for me to sign out. Hope you have enjoyed this lecture. The people that came for the first time, thank you. God bless you. Mercy, you still stay around. God bless you. I appreciate you. Thank you so much. God bless you. Sky success. I can see so many people. Thank you, thank you, thank you, thank you. God bless you. 2 minutes more. Ẹ̀yin tèmi báwo ni o ṣe wà o? La 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 la. Ọlọ́run á jí wa rí o. Thank you so much for coming. Till I come again, I remain the fashionable midwife. Let me end the YouTube.